Hello everybody, and welcome to a special edition of the Nicholas Snow Show here on PromoHomo.TV, which this summer has expanded into a full-fledged broadcast network with 5 series. This is my second in a series of 6 episodes this week, celebrating the 36th anniversary of Desert AIDS Project. I'm a grateful client of Desert AIDS Project, and I'm actually broadcasting live from my home studio, which is on campus of the Desert AIDS Project in their affordable housing. I'm so grateful to D.A.P, and my guest today is Dr. David Morris, the Chief Medical Officer of D.A.P, who happens to be my personal physician as well. I feel really privileged because all week long, key members of the D.A.P team are appearing on this show in live conversations, which demonstrates a lot of trust that they have in me and my desire to advocate for them and to tell their story. Which leads me to say that even though Desert AIDS Project has been a longtime sponsor of my media pursuits, this series of episodes is pure journalism, not advertorial. I decide what I want to say. I don't do infomercials, which is advertising disguised as editorial. I don't do that on my show. So I just want to be clear, I'm doing this series of episodes because I love D.A.P. They're doing so much for our community. They've become a huge example for the world to follow when it comes to delivering important care, and I get to share them with you today. So I have a surprise for you. In this show, I'm going to bring you some video that was shot on location at a private event for Desert AIDS Project staff. It was the unofficial staff ribbon cutting for the new clinics. So that's going to be coming up as well. You want to stay tuned, and I'm going to be back with Dr. Morris and that video clip after this. D.A.P is celebrating its 36th anniversary this year. But for the last many years, at least 5, the board of directors, the staff, the donors, the volunteers have been mobilized to transform the work and mission of Desert AIDS Project. Because the pandemic hit, a lot of the celebrations and tours of their expanded facilities were not able to happen. So I'm honored that I'm going to bring you a glimpse today inside their new clinics, but also celebrate some of the poignant words that were shared on February 27th, 2020, as the staff of Desert AIDS Project gathered to celebrate that particular day. It was quite an event, and I'm bringing a short glimpse of it to you right now. This is the unofficial staff ribbon cutting at the new clinic at Desert AIDS Project.
So it's
I'm
a very
bringing it to you
special
live.
day in the
This is
history
David
of
Brinken,
Desert AIDS Project
CEO speaking.
and the human rights movement that we've all dedicated our lives to. So thank you all for coming out over your lunch hour to help us dedicate this new facility and to open it up.
I know that you tell me that, hey, this is just what we do, that you do it every day, you deliver the best level of care, but don't take it for granted. We don't, our clients don't. You deliver every single day exceptional care, and we are grateful for it, and our clients are grateful for it. So thank you all.
Thank you, Steve, and thank you, board members. Now, Dr. David Morris, our Chief Medical Officer.
Thank you, David and Steve. And lastly, I want to say D.A.P. has greatness in it. I thought that the day I interviewed. I still think that. I think we are great. I think we have more greatness to go. And I think about things like just in the last 4 years, Hepatitis Center of Excellence, an ID department, a transgender growing area for Transgender Center of Excellence. The Chopra Research Project is coming soon. We landed the Anchor study, a national study for research, and now we're adding women's health care to that. So I say kudos to all the hard work of everyone here, and I say here we grow again, and kudos to D.A.P.
Thank you, Dr. Morris. Let the most stigmatized and marginalized person find us, no matter their sickness or their pain. Find out that for all of us, healthcare is a human right at D.A.P. And so is dental care, behavioral health care, a roof over one's head, and food in their stomach. We all know too well the cruel power of stigma and discrimination. And our passion in the model that we created through very hard lessons learned through the AIDS crisis and homophobia wins out every time. Our growth, these new clinics behind me, you all being a part of our mission in today's world, that is a radical life lived with purpose. Thank you all so much for being here.
I just want to congratulate you both, and I was wondering if you would like to talk about your own connection, because you're the Chief Medical Officer, you're of course the CEO. How has your relationship helped fuel this project?
As Dr. Morris said, the very first time he and I met, we looked at a physical model, kind of like a wedding cake, of what the future could look like, and we both agreed we were going to do what it took to actualize today, and that was 4.5 years ago, right? 4.5 years?
Yeah, so the thing that this new building really allows us to do is we've got it hand-tailored to make a patient-centered medical home. And that's a new model, a new way to practice medicine. And it puts us in teams together to really take care of patients in a new way in the community.
Well, as I share, I'm a grateful client of Desert AIDS Project. Glad to be a cheerleader for them. And Dr. Morris, you're my personal physician. I couldn't be more honored. And congratulations to both of you.
Thank you. We're so grateful to the community for helping us make this happen. We couldn't do it without all your viewers.
Thank you so much. That video brings a smile to my face for so many different reasons. It was broadcast in its entirety, that ribbon cutting live. You can find it on the official Facebook page for Nicholas Snow, the official verified page, the entire about 25-minute video that happened to this day, that day. But the other reason I'm so excited about it is because I was able just now to take Dr. Morris back to that moment, and so many people in the public haven't seen words or statements or ceremonies like that because of the pandemic. I wanted to let you know, if you're watching live and if you comment live, your question or comment may make it onto the screen like you've just seen. So before joining D.A.P. in 2016, Dr. Morris was the medical director and attending physician at Pride Medical, an LGBT-oriented clinic in Atlanta from 1999 to 2015. He's a certified HIV specialist and board-certified family medicine physician with a proven commitment to the medical excellence of hospital and outpatient clinical experience. David attended medical school at the Emory University School of Medicine in Atlanta and did his residency at Memorial University Medical Center in Savannah. His certification and licensure include the American Board of Family Medicine, American Academy of HIV Medicine, California Physicians Medical License, Medical Board of California, and Georgia Physicians Medical License. David has been part of missions to El Salvador, where he did research on the effect of chiropractic adjustments in lowering blood pressure, as well as volunteering with Doctors Surgeons Without Borders in Colombia. He also volunteered with Dr. Robert Grant of the San Francisco AIDS Foundation on ending the epidemic with PEP and PrEP. Among his research projects at D.A.P. are HRA anal dysplasia and treating antibiotic-resistant gonorrhea. He says, "At the end of the day, my professional commitment is pretty simple. I want D.A.P. to provide a safe space for our patients to be well, healthy, and happy." And I must say that David does a great job with that, and I'm going to bring him on camera right now to talk to us. Welcome to the show, David.
Thank you, Nicholas. Thank you very much.
How was it to go through memory lane back to the staff ribbon cutting?
Well, it was great. It reminded me that our introduction to our 2 new clinics was actually eclipsed by COVID-19. And so I think some of the fanfare, enthusiasm, and stuff just got overshadowed by us opening our COVID clinic. So it's really nice to revisit that memory. Thank you.
You're welcome. You bring up an important point. So serendipitously, literally within days of the new clinic opening, making the old clinic available, COVID hit, and within almost immediately, your team was able to transition the old clinic into a COVID clinic. So why don't you describe this rapid response, DAP's rapid response to the COVID pandemic, as well as the importance of the institutional and organizational knowledge of memory DAP brings to the table in fighting the pandemic?
Yeah, so Nicholas, thank you for that. It's very interesting. About March the 16th, we saw this tsunami wave coming on. And we also were at the time moving into our new clinics. And there were many people, several of us literally came in one weekend when we had evacuated the old health center and the dock to begin the new health center in the green and the blue clinic. And we said, wow, we've got this incredible opportunity to open up a COVID clinic. And we saw it as a challenge. We also saw it as this is in our DNA core as a place very seasoned in infectious diseases and HIV and the LGBT community and stigma reduction. It's in our DNA to do this. And collectively, there were about 12, 14 of us that came in one Saturday and just said, let's do this. Let's take the old space, let's commit it. Let's commit our staff and our time and our resources. Even before we had funding for anything else, we said, this is the right thing to do. We responded to the HIV epidemic when it opened, 1984-ish, and we've got it in our DNA. We've done hepatitis C. We've got infectious disease doctors. Let's do this thing. And so we did, and that's how it was born. We simply came in, we sterilized the rooms, we got the PPE, we just did it. We made it happen. We got volunteer, we got like Dr. Du volunteer, Dr. Foltz stood up to the plate to direct the opening of the COVID clinic, and now here we are months later, almost 3,000 patient testing later, and we're going strong, and we're committed minimally to another year of this COVID clinic to step forward.
While we're on the topic of COVID, it was fascinating to me. In February, Desert AIDS Project honored Dr. Deborah Burks for her lifelong commitment to the fight against HIV and AIDS. And literally within weeks of Desert AIDS Project honoring Dr. Burks, she's ended up in such a huge way on the world stage. One of the things that gets lost in what she's doing today is that people are unaware of her commitment and her participation in the fight against HIV and AIDS. And I was wondering if you could speak a little bit to your knowledge of her work and how come she came to be honored by D.A.P.
Yeah, so Steve, I had the very good fortune, Nicholas, to meet her in both South Africa, in Rwanda and Africa, and also in Geneva, Switzerland. We were attending the ACASA conference for AIDS in Africa, and we got to know her actually very well there. And then she was at the Steve Chase. She sat to the right of me at our table. She gave an amazing speech. She also received the award uh, from D.A.P. And several things we talked about a lot. She's been fighting the HIV epidemic in an enormous capacity at HIV/AIDS in Washington D.C. She's been managing budgets. She's been the top of U.S. AIDS and World Care for AIDS, and she was also very instrumental in fighting and being on the top front of the Ebola epidemic. So we're very proud to know her and her association with D.A.P. and also to watch her in the White House and
Dr. Fauci.
Dr. Fauci to really do quite well. Um, and so she knows about D.A.P. She knows about the fight, and she's giving a lot of instruction with Dr. Fauci on how to proceed forward. So we're very fortunate to know her and to have worked with her.
Thank you for your comments on that. I wanted to help get that information about her great work out there. One of the opportunities I had yesterday on the show was to interview George Sonsell, who was the first executive director of Desert AIDS Project, and I was wondering if you would do me the honor of something that I did with him. I was wondering if you would tell me what was going on in your life in the late 70s, early 80s, when what would be known as AIDS showed up,
Yeah.
and how that informed your personal experience, your life choices, and the direction of your professional career.
Yeah, so Nicholas, I started my physician career in 1984, which is exactly the time the D.A.P. started. I was north of Atlanta, Georgia. I was at a federally qualified center as a medical director, and I started seeing patients and friends, family members developing HIV and AIDS, and saw this, disaster hit not only the United States but the world. And I decided pretty early on, I ended up medically managing with infectious disease doctors, patients that had HIV and AIDS. And, I saw so many people die, so many people ill. I saw the beginning of all the early trials and antiretrovirals and the toxicity of AZT. And so I was there from the beginning of it. And I had decided, after about 13 years of that practice, to actually move into the city, into Atlanta, to work in an HIV-centric practice, LGBT practice. And that's where I learned about how to treat and how to manage and how to be an advocate in the HIV community. So it was those early days, and I saw the need, and it includes stigma reduction. It included working with people that were so overwhelmed with this disease, including nurses and hospitals and infectious disease doctors and primary care, that I just saw it was my calling, and I've been there ever since. And I'll also be there till the end of my career, and I want to see the end of AIDS, and I want us to continue all this hard work and not let it go.
When you mention being in Georgia, and you also talk about stigma, and we're talking about the mid 80s, I was wondering what sort of stigma were you seeing, and how did you go about with your community fighting that stigma?
Yeah, so I'll give you a personal example. I had I had a woman come to me. I was taking care of her for hypertension, diabetes, primary care. And she said, would I do a house call for her son? And she gave me the particulars that he was advanced AIDS. He had whittled down to probably about 90 pounds in a hospital bed in their living room in their house. And part of it was about hospice and comfort measures, and very few people were trying to help take care of him, and so on. And she was overwhelmed. And so I did. So I made the house call. But in the middle of it, and this poor guy was, probably within 2 to 3 weeks of dying, and had uh, esophageal candidiasis, end stage psychosis going on. And it was really very, very disheartening and sad. But during the visit, a brick was thrown through the living room window, and the brick said on it, "Die faggot." And it's actually, that was the day I knew I was going to do this. I saw that stigma right there in the face. I saw the look on her face. I saw what was going on generally in medicine. And that was a day that determined my career path. So, also in Atlanta, there was a lot of work to be done in the African American community due to the stigma, due to people not wanting to reveal their diagnosis, about not being informed about taking medications. And then we had PrEP come along. And so part of our goal, and part of what I did at Pride Medical, was really try to help the African American community, as a group that were particularly hit by HIV and AIDS.
That's amazing. And we know that more so than ever, we're aware that black and brown people in our culture built upon systemic racism and white privilege has overlooked and oppressed the adequate delivery of health care to people of color. And you've been fighting to be part of that solution for a long time. How is Desert AIDS Project, and what sort of steps is the Desert AIDS Project taking to reach the underserved communities? Because historically, you have served primarily people living with HIV and AIDS, but as part of your expansion, in addition to staying focused on your core mission, you now are reaching other people that are in desperate need of services. Why don't you talk a little bit about that evolution?
Yeah, so we have reached out through, we have programs like Prep and Play, came out about a year and a half ago, and we were very concerned about the high rates of HIV/AIDS in our Latino community. We also have concerns about improving and increasing women's care at D.A.P. We now have a research department. We have currently 4 or 5 research programs that have started.
You also have the Transgender Center of Excellence as well.
We do. Currently about 85 patients, and we have a projection of up to 1,200, 1,500 over the next 2 to 3 years. It's a very important part of our evolution and care, and we feel like we have the competency of really taking care of these patients.
Well, one of the points I wanted to make, and correct me if my stats are wrong, is now more than 50% of Desert AIDS Project's patients are not, in fact, living with HIV. So you're able to actually treat everybody who is in need of your services, and many people can choose Desert AIDS Project through various programs that give them access to health care.
Yeah, and Nicholas, I've seen that every day. I'll have patients call me and they say, I want to be at D.A.P, but I don't have HIV. And I say, well, we're at about 55 to 58% plus of doing primary care. It's part of why we moved into the new building, have the green clinic, the blue clinic. In another year or so, we'll end up having a red clinic, which will be primary care. But I easily take care of 50% of people without HIV, but they need the care as well as everybody. So there's enough room for everybody, primary care and HIV and transgender and hepatitis C and infectious disease, that we have the capacities and the expertise to do it all. Also, a part of being a federally qualified center is you're expected to do, and you want to do, primary care for the community at large in the Coachella Valley. So we're opening our doors, we're expanding, we will expand our staff to accommodate that, and our goal is to practice high-level quality medicine for all people that come through our door.
Well, I'm living powerfully with HIV, and I have Desert AIDS Project to thank. You are fearlessly out of the closet, and I know that professionally you had the opportunity to either go to San Francisco or to come to Palm Springs, which either city would be a wonderful place for a gay man looking at where they might want to retire. How did Desert AIDS Project and Palm Springs win you over?
Yeah, so it was very interesting. I was being groomed for, and I was working at the goal of going to the San Francisco AIDS Foundation and looking at a job there as being their medical director. And in the process of it, D.A.P was searching for a chief medical officer that had administrative and medical experiences to bring to help lead them, for the next 10 years. And I found out through an interview with the person that was coming on board uh, that they were looking for this, and I was contacted, and I was asked to come out and interview. Although I pretty much had my goals set on going to San Francisco, I also had a job opportunity in Portland, Oregon, as teaching in primary care and HIV. And so I got invited to D.A.P, not knowing anything about it at all, and ended up staying 3 or 4 days in Palm Springs. And I'm telling you, the day that David Brinkman took me on the tour at D.A.P, I knew this was my home. I knew it was the place I wanted to be. I was so impressed with the wraparound services, with the primary care, with social services, with the food pantry, with the dental program, with community health, linkage to care workers, behavioral health department, dental department. And it was these wraparound services, including subsidized housing and a home for people to live in. And I was so impressed with leadership and the board of directors and the long history of D.A.P. It just felt like home. It was also a better fit for me than San Francisco or Portland. So I really came in through the side door. I wasn't really looking I didn't know about D.A.P. And I'm so glad that I got invited and that I took this job, and I was able to become part of this really wonderful team.
You mentioned David Brinkman. I have the honor of interviewing him later in the week. And he's not the sort of person to toot his own horn, but you have spent a lot of professional time with him and have become great personal friends. You've gone with him to observe the United Nations. You've gone on trips together to share the work and vision of Desert AIDS Project to other places in the world, and you have also learned from them as well. And I would just like you to talk about your professional and personal connection to David, and let the rest of the community know why so many people look up to him. And for those that don't know the extent of who he is and what he does, I'd love for you to toot his horn.
So, Nicholas, the first word I would say would be visionary. Um, from the day I met him, he was talking about expanding D.A.P. He was talking about bigger pictures than what we see every day. We're currently doing a expanded 30-year lookout, 30-year lookout for the future of D.A.P. And truly, he's a visionary in that sense. And looking at connecting with other groups of organizations, about looking bigger than what we see every day. I've never worked with anybody like David before. He's an avid reader. He brings back all kinds of great ideas from national meetings and world meetings. He's also very authentic, and he's great at his word. Um, he is voracious. He works so hard, and I just admire him so much. And he's truly been committed
like most of us, to ending the AIDS epidemic and also to working in marginalized populations and people with stigma and really bringing it home for his community. So it's just with the greatest of respect and pride that I'm able to work with him. He's a big part of why I'm here at D.A.P.
Now, how did the two of you end up being observers at the United Nations, and what was that like?
So it was actually two parts. One is um, that 2 years ago at the Chase, that we had a group of people, invited guests from Africa and UNAIDS, and they came and saw DAP, and they loved the 35-year history. They loved the model of DAP. They were very impressed with what we did on the scale that we did it, and so we got invited to be part of a national conference, ICASA, the International Conference on AIDS in Africa, to really talk about DAP and particularly about Get Tested Coachella Valley and our linkage to care programs, how they were developed. And, and then in the course of that, it turns out UNAIDS and the World Health Organization were convening for an annual meeting, and they invited us to become part of the dialogue about the end of AIDS and what we need to be doing nationally and internationally. It was an enormous educational process and great pride that we were able to uh, represent DAP and at that time the 35 years of all the programs that we had going.
You mentioned the Chase. For people that do not know, that's the Steve Chase Humanitarian Awards, an annual gala fundraiser, hugely emotional and inspiring event that happens every year. Of course, we're in a pandemic year, so who knows what's happening in early 2021 when the event would usually take place. I guess that's TBD. Just from my own personal experience, I just want to share that I hadn't really done telehealth before, but now telehealth is available for anyone that wants to have a telehealth appointment with Desert AIDS Project when an in-person appointment isn't mandated, and that's good with the mental health providers and MDs across the board. And I am able to come and see you in person as well. I'm a beneficiary of the mental health department, and I have my telehealth appointments for my therapy. But recently, I got to see you in person for my routine checkup, and I'm just very comfortable because of all of the screening that happens. Would you describe the COVID precautions that are in place for those individuals that are coming to the facility for care?
Yeah, I'll start with really talking about the telehealth. You know, we began that about March the 20th or so. We got special training for it. And it turns out we really embraced it. We just said, we know this is going to be part of this COVID epidemic. And it's like the technology's there. We'll be able to have people that don't want to get out, not get out. We'll be able to protect staff and patients all at the same time. So we did it with telemedicine, also the virtual MyChart, which allows, like we're doing, a Zoom type meeting that you can see visual as well as hear. And at one point, we were probably at 50% telehealth or to the virtual MyChart. I've really embraced it. I personally like it a lot. I like patients having the option, if they don't feel well, if they don't want to get out into the community, that we can still take care of the visits without physically having to come in. You know, and there are enormous measures for protection at DAP. When you come into our buildings, you're screened. We have thermal screenings now. We had from the beginning, you have to be screened with questionnaires. And then everyone coming in has to wear a mask as the patients, keep them on. The same with the staff. If patients are symptomatic or they've had an exposure in the questions coming into the building, they end up going over to our COVID clinic to get tested either for the virus or for the antibodies, depending on the situation. So I feel very comfortable. I feel very safe at DAP because of the hand washing and the mask policies and the social distancing. There's all kinds of helping tools in the building to stand 6 foot apart. And so I think we've navigated it actually very well. And we will continue to do this until we get on top of or improve with the epidemic.
Well, I feel very comfortable going there, and I'm glad for the opportunity to see you. And we're celebrating because for the first time in a long time, my cholesterol, all the levels are within normal limits. I have lost around 40 pounds, and I think you and I both agreed that I'm as healthy as I've been since you've known me.
Yep.
So
Yep.
I'm just excited about that all around. Is there anything you would like to add to our conversation that we haven't addressed about the past, present, or future of Desert AIDS Project?
Yeah, I would like to end with a message about people living with HIV and AIDS, in particular, to feel hopeful, to know that we'll get through this epidemic, to know that we'll see the end of AIDS. Um, and this applies to throughout the Coachella Valley. So, we get wrapped up in the death counts and the number of new patients and so on. But, I see going beyond. I see healing. I see that we will get through this. We'll get over this. Um, and I'm just very hopeful and optimistic that we have a good future there.
Well, same here, and I appreciate you so much and Desert AIDS Project, and I'm honored to be able to help celebrate the 36th anniversary of this important community institution. And so thank you for your service.
Yeah, thank you, Nicholas. You're awesome. I appreciate the chance to have this chance to talk about DAP.
Thank you. If you stay put, David, I can speak with you briefly after the show.
Okay.
Thank you so much. And I want to thank all of you for my conversation today with the good doctor. And as you can see for yourself, he is. And this is the second of 6 episodes celebrating the 36th anniversary of Desert AIDS Project. Tune in to one or all of them, and you can find all episodes at PromoHomo.TV. And I will see you next time.